Good news for millions of Medicare users. Telehealth services that were expected to end soon will now continue through 2027, giving seniors and healthcare providers more time to access and offer virtual care. Let's break down what this means and why it matters. Welcome back to MedCare News, where we keep you updated on important healthcare changes that affect Medicare beneficiaries. Today, we're covering a major update in Medicare policy that keeps telehealth services available for 2 more years. The U.S. government recently passed a federal spending bill for fiscal year 2026 that includes a 2-year extension of several Medicare telehealth policies. These policies were originally introduced during the COVID-19 pandemic to make healthcare more accessible. Now, without this extension, many of these telehealth options were scheduled to end in early 2026. Instead, they will now remain available until December 31st, 2027. So what exactly is being extended? Well, first, Medicare patients can continue receiving telehealth visits from home without needing to travel to a clinic or a rural medical site. Second, more healthcare professionals will still be able to provide telehealth services. This includes specialists like physical therapists, occupational therapists, speech-language pathologists, and audiologists. Third, audio-only visits, such as phone consultation, will still be covered when they are medically appropriate. This is especially important for patients who may not have access to video technology or reliable internet. For healthcare providers and hospitals, this extension offers more stability when planning telehealth programs. For patients, especially older adults or those with mobility challenges, it means continued access to conventional virtual healthcare. For healthcare providers and hospitals, this extension offers more stability when planning telehealth programs. For patients, especially older adults or those with mobility challenges, it means continued access to convenient virtual health care. However, it's important to note that these changes are still temporary, and policymakers may continue debating whether telehealth flexibility should become permanent. For now, Medicare beneficiaries can continue using telehealth services under these expanded rules through the end of 2027. We'll continue following updates on Medicare policies and telehealth legislation as they develop. If you found this update helpful, subscribe to the MedCare channel for the latest Medicare news and healthcare updates.